To the basics here. Chronic pain, there are people that are trying to live with that. Dr. Schwartz is here to give us some ideas of what you can do for that. He's coming up in just a few minutes.
All right, can't wait.
Yeah.
A bag that'll save you money by keeping your food fresh for weeks?
They say you just put it in, twist it off like that, and leave it like that.
Really? Tonight at 6, consumer advocate Heather Sullivan puts the Debbie Meyer bread bags to the test on Does It Work? Tonight at 6 on News Channel 7. News Channel 7 is on your side, solving your problems.
It's so good to have a champion to help me through this. It's just wonderful. Thank you.
If you have a problem and need answers, write our problem solvers at WSBA.com. Keyword problem solver.
Cutting-edge designs reveal a confident, modern side to Rug & Home. From weekend villas and retreats, beach cottages to modern mansions, our contemporaries give the home a unique identity. Our assortment of designs reveal innovative ideas, international styling, and global culture. Right now, the entire collection of contemporaries is on sale. Mansion size at $839, room size at $679, even runners priced at $244. You know, decorating is all about vision, and Rug & Home is a paradise for the visionary.
A CNN News report uncovers the secret practices of the top insurance companies, tactics that prey on innocent car accident victims, betting the victims won't wait, won't sue, and will walk away with what little they get. The worst part? Insurance companies get away with it as much as 90% of the time. Don't be a victim. If you've been injured in a car accident, call the lawyers at Crumley & Associates, 1-800-288-1-LAW.
Blonde is now a singing, dancing, mega-hit musical. This blonde conquered Broadway, and now she's strutting her stuff and taking the world by storm. In style, Legally Blonde. Get your tickets today. It's Elle Woods, and she's starring in her very own hit musical, proving beauty and brains really can come in one knockout package. Legally Blonde.
March 24th through the 29th at the Peace Center.
What are you eating?
Multigrain Cheerios.
So, trying to watch your weight?
No, why?
Nothing, it's just the box. It says it's low in fat.
Do I look like I need to watch my weight?
No, it just says it has 110 calories per serving.
Yeah, but there are other reasons why I like it.
I know, it's the box.
What else does the box say?
Box says shut up, Steve.
Multigrain Cheerios cereal, because it tastes good. Try new Banana Nut Cheerios with the great taste of real banana.
Larry went to the doctor yesterday and had to pay a lot of money. The visit, the CAT scan, and the prescriptions. On our fixed income, I'm not sure what we're going to do.
Let me tell you about Guardian Healthcare's Medicare Advantage plan. That's what we have.
Guardian's Tribute Plan. It's everything you need beyond Medicare, and we're right around the corner. Call now to learn more about the many advantages you get with this easy-to-understand healthcare plan.
Louise, you have all the answers.
This segment brought to you by Piedmont Physical Medicine and Rehabilitation.
That's right, and the gentleman that knows a lot that will share it with us right now is Dr. Robert Schwartz. Dr. Schwartz, welcome. That's a pretty long title there. That includes physical pain and rehabilitation, and of course it covers a lot because you've written the book on the subjects, haven't you, huh?
It's a very big book. We certainly encourage everyone to get it. Lots of good information.
Well, you know, that could give you back trouble just lifting that.
No,
you know,
no.
That's a big, thick book with lots of information in it. Welcome to our show.
Put it on the table.
It is almost a coffee table book because it deals with so many different subjects, and that's kind of where I want to start with you. In addition to neck and back pain, I think we all associate as chronic conditions,
sure,
chronic pain. In addition to those, what other ailments might you be treating?
We deal a lot with weather-sensitive pain, including those that have fibromyalgia or reflex sympathetic dystrophy.
Right.
Lots of sports injuries, people with ligament injuries, joint injuries, osteoarthritis, and people with nerve pain, as well as peripheral arterial disease.
And a lot of these things go with age or worsen with age, right?
But, they can. It doesn't have to be somebody who's older, though. It can be a weekend warrior. It's not just an age-specific problem.
Overdoes it?
Yeah.
Yeah.
Right. Yeah.
Well, I know you've helped some of our folks at Channel 7. I'm thinking of Lisa over here, haven't you?
Well, you can say her name, I can't, but I think she's done real well.
Yeah,
Thank you.
she is one of our ladies that works with us, and you've helped her a lot. Now, listen, what makes your approach a little different than other places like you?
We try to get to the root cause of the pain. We don't really just cover up the symptoms. Because I'm boarded in physical medicine and rehabilitation, and I'm also a fellow in vascular medicine, we can treat those patients that have both complex pain problems and other medical conditions that can impact that pain.
So you're not just covering up the pain.
Not just treating the symptoms.
We're trying to fix the source.
We're actually doing a little digging and fixing the source as well.
You're with St. Francis, or
my office is in the professional building next door to St. Francis downtown.
Downtown. All right, here in Greenville, of course.
Yes.
Let's talk about your method with getting to the root of pain and not just covering it up.
Yeah, I mean, our approach is a little bit different. We really take a holistic approach, meaning we look at the whole person, and then we try to not just isolate that one little disease and separate from them. And we call it reducing total load, the total number of things that don't allow you to get well. And then we take the approach that we're going to work on those, getting rid of them and fixing them one at a time.
One at a time. Now, are some of your treatments innovative, you think, and compared to others?
We have a lot of innovative treatments. In addition to your traditional medications, first thing is we have a non-narcotic approach. So we don't want to get anybody addicted. We don't want to get anyone strung out on medications, but we'd rather use medications that actually can fix the source of the pain or help the source of the pain. We do various kinds of injections that can reduce or repair nerve injuries or actually regrow ligament. We have a procedure that can repair tendons without having to go to the operating room. We also do motion analysis so as to relieve pressure on the joints and to improve function. So just a whole host of those kind of things.
Those are great procedures, but what kind of testing do you do to see what procedure they need, or their diagnosis?
Yeah, I mean, the whole idea is to prove what's actually wrong. I mean, so many people have been just given a medication to treat their symptoms, so the idea is we want to find out what's wrong to begin with. So in addition to traditional x-rays or MRI or lab, we'll do electrodiagnostic studies to look for nerve damage, musculoskeletal ultrasound, same thing they use for babies and gallstones. We look to image for torn or stretched ligaments and muscles. We do non-invasive vascular testing to assess if there's enough blood flow. We have a gait analysis or motion analysis lab, so we can see how the person's functioning, so we can unload some of those osteoarthritic joints.
This isn't done on a you're not guaranteed that this process is done, that we do this much digging into the problems necessarily when we go to a doctor, are we?
Well, you have to have a certain dedication towards this. You know, when you go just to your family doctor, he's want to make sure that you don't have a heart attack, that your blood pressure's not sky high, your diabetes not way out of control. And we would call that reducing total load. You need to do those things.
Sure.
But truthfully, it's complex. Most pain isn't just from one simple thing. So it takes a lot of work, and you have to have somebody who really cares and is dedicated towards working on those things one at a time.
And that's you. You just, if you're not a genius, you're darn close. I can't imagine the book. When can we get that?
Well, the book is called Resolving Complex Pain. You can get it at any online or local bookstore. You can order it, or you can get it on our office website as well. And we really just try to make it real user-friendly. Great story behind it. I had a patient who really was bedridden and was looking at our website. We have a very big website, PMR.com. And this patient said, you know, you really need to publish your website. You need to turn it into a book. And so,
you did.
And so I said, well, we'll go ahead. And she goes, well, you don't understand. That's what I used to do before I was bedridden. I used to be a medical editor.
And so you helped her get out of bed.
Fully functioning, and she did that as a kind of a share. So delighted.
Yeah. Give me an idea of some of the topics that are in this book, because that will make some people definitely want to check it out. I know I asked you earlier, my dad suffers from Lyme's disease. So I ask you, and you do deal with Lyme disease patients as well.
Right. So
I think it is.
A lot of patients that have complex problems, they'll have hidden infections. They might be like lupus-like. They have lupus, but they don't. They have immune system problems. There's usually some other medical issue going on that's not allowing that normal ache and pain to go away. So we cover those treatments in the book, and then we try to define them. Anything from just regular neck and back pain to thoracic outlet syndrome, dystrophy, fibromyalgia, lots of information on sports injuries.
A lot of people have migraine problems.
Migraine's a good example. Mixed headaches, lots of sources of headaches for migraine.
Restless leg, I think that runs in the Roper family. I think the Ropers invented restless leg syndrome.
Yeah. Okay.
It'll be in your next book.
There you go.
Well, Dr. Schwartz, we thank you so much for stopping in. It's really interesting, and we'd love to have you back to maybe get in deeper on some of those subjects.
Thanks for the opportunity.
Thank you. Good to see you. Appreciate it.
Dr. Schwartz, you can find him over there by St. Francis downtown. Ubi coming up. Now, this is one of those huge companies that we are so proud to have in our area, even, yes, taking care of some of these shirts here in Michelin and Maine. But this big company has done some great things for our community. We're going to talk to the folks at Ubi and find out what that is coming up.
Buy a 2009 Chevrolet Malibu for $17,750 or $2,000.